if you are done eating, so the clean area, you can start trying to find some open area and take your seat. That will help us to get our program started soon. Okay, and also we need to wrap up the rest of the plastics that's on the floor. Please grab a chair if you have to still eat. You can grab a chair and eat there. Okay, so that way we can clean it up. Assalamualaikum. I think this side of the floor is clean. If you move this way, it will be easier for us to clean in the back. So grab a spot. I think alhamdulillah, a lot of people in here. So we will get started very soon at 8 o'clock. I think it's a few more minutes left. Okay. It's better. So please come move forward in the masjid here. Both sides, both sister sides and brother side, come as far forward as you can. So we still need to do some cleanup in the back. If you move forward, it'll be easier. So we'll get started at 8 o'clock. And we have a couple of speakers here and we have imams, so we'll continue. But I think with your help, it will be easier because I know this is a weeknight. People we'll try to wrap it up by, I would say 8:30, 8:40 time frame. So we'll have some session here. Then we'll have some breakouts, 20, 25-year-old. Then after that, we'll Maghrib prayer. Just following Maghrib prayer, we'll have a special dua for the brother here. Then we'll have other discussion as well. So this is the plan. So with your help, we should be able to get started soon, inshallah. Please move forward, please. We need some room standing in the back. Please move forward. Find a spot in the front of the masjid here, because I think the brother Muaffaq, he is working very hard to clean it up. So without your help, it will take longer. Please move forward so we get some space there and clean it up. Okay. Come on. Yes.
What are you doing? Hold on.
Yeah. Have a seat, please.
Yeah, sure. We're looking for Imam Tazim. Yeah, he'll be here. Okay, thanks. Yeah, have a seat. Doctor on the side. Yeah. Assalamualaikum. Good. How are you? Oh, Imam Tazim. Nice to meet you, Omar. And Dr. Amr Sadri.
Assalamu alaikum again. I to all. Please, as we have our guest speakers, please keep the voice quiet because it's very difficult to listen. This is a very critical talk for ourselves and our children. So if you can keep the noise level lower, it will help us, help you also. Because these are like, we don't do this kind of event that often. And the whole community just went through a heartbreaking event, So we like to maximize our efforts here, the efforts of our guest speakers. Please keep the noise aside. If you could leave the noise level down, it will help everybody to listen, okay? And unless you want to talk, please come over here. We can also talk at the end of the event. So you're welcome to do this too. But right now, let the speaker talk, please. Thank you.
Yeah, I have an adapter here. Can you be looking for? Yeah, same one. Perfect. Here, I'll use mine since I brought it with me. I don't. Okay. And just because my plans, I have slides here, but I'm not going to use them. I'm going to send this thing, and then we'll see. It's going to be mainly very good. Do we have a microphone that can be passed around? Yeah.
السلام عليكم ورحمة الله وبركاته. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. وقالوا اتخذ الرحمن ولدا لقد جئتم شيئا إدا تكاد السماوات يتفطرن منه وتنشق الأرض وتخر الجبال هدا أن حول الرحمن ولدا وما ينبغي للرحمن أن يتخذ ولدا إن كل من في السماوات والأرض إلا آتي الرحمن عبدا لقد أحصاهم وعدهم عدا وكلهم آتيه يوم صدق الله العظيم.
السلام عليكم ورحمة الله وبركاته. الحمد لله رب العالمين، والصلاة والسلام على الشيطان الرجيم. بسم الله الرحمن الرحيم. من عمل صالحا من ذكر أو أنثى وهو مؤمن فلنحيينه حياة طيبة. صدق الله العظيم. Alhamdulillah, we are extremely honored and privileged that alhamdulillah we have amidst us here today 3 psychiatrists, alhamdulillah. And this is a very rare opportunity we get, alhamdulillah, to host such individuals. So may Allah subhanahu wa ta'ala put blessing and accept their effort that they're able to make time for us. And may Allah subhanahu wa ta'ala make this session a beneficial one for all of us here. Respected brothers and sisters in Islam, one of the articles of faith that every Muslim must believe in order to be a Muslim is to believe in the qadr of Allah subhanahu wa ta'ala, the destiny, the decree of Allah subhanahu wa ta'ala, that we call al-qadr. Al-qadr khayruhu wa sharruhu hulwuhu wa murruhu min Allah ta'ala. That we believe in the fate, the decision, and the destiny, the decree of Allah subhanahu wa ta'ala. It's good, and the one that does not seem so good. Or the sweet part of the destiny, or also the person of the destiny. Everything that we must believe in order to become a Muslim. And along with having belief in the destiny and the decree of Allah subhanahu wa ta'ala, we must have this belief that whatever Allah subhanahu wa ta'ala decides for his creation, it is for their own good, whether we understand it or not. Whether we understand it or not, even the masa'ib, the afflictions, they're also at times a source of mercy and blessing for human beings. Prophet sallallahu alayhi wasallam says in a hadith that إِنَّ الْعَبْدَ إِذَا سَبَقَتْ لَهُ مِنَ اللَّهِ مَنْزِلَةٌ لَمْ يَبْلُغْهَا بِعَمَلٍ. That when a person, Allah subhanahu wa ta'ala decrees for that person a status that he is meant to enjoy, high status in the sight of Allah subhanahu wa ta'ala, by Allah subhanahu wa ta'ala in Jannah. But lam yablughu bi'amal, that his amal is not strong enough to take him to that status. Then Rasulullah sallallahu alayhi wa sallam says, ibtala ثم صبره على ذلك حتى يبلغه المنزلة التي سبقت له من الله. Then Allah subhanahu wa ta'ala grants him patience to counter those afflictions and trials of life with patience, so that that person, his patience and sabr on those bala and masa'ib and afflictions make him reach that status that he's in of Allah subhanahu wa ta'ala. So from this hadith, the message is that, brothers and sisters, even the afflictions, they sometimes, or almost all the time, they're actually a form of mercy from Allah subhanahu wa ta'ala, whether we understand it or not. And the message is that we must remain optimistic. We must remain hopeful and positive, even in the midst of afflictions and trials. There's a narration where Abu Hurairah radiallahu anhu narrates from Rasulullah sallallahu alayhi wasallam that he says, وَصَبٍ وَلَا هَمٍ وَلَا حُزْنٍ وَلَا أَذًى وَلَا غَمٍ حَتَّى الشَّوْكَةَ يُشَاكُهَا إِلَّا كَفَّرَ اللَّهُ بِهَا مِنْ خَطَايَا. That no believer is afflicted by any hardship, any disease, any type of sorrow, distress, sadness, harm, calamity, so much so that even if he's pricked by a thorn, that Allah subhanahu wa ta'ala, by the virtue of the discomfort that he undergoes in his suffering, Allah expiates his sins. So this hadith not only shows that Rasulullah sallallahu alaihi wasallam acknowledges those mental issues and problems that people face, that Rasulullah not only acknowledge it, but he also mentions that Allah subhanahu wa ta'ala is also aware of it. And Allah subhanahu wa ta'ala is the one who is testing people with all sorts of calamities. And at the end of the day, those things turn in favor of that person. But the key word Rasulullah sallallahu alaihi wasallam says we have to have tawakkul and trust in Allah subhanahu wa ta'ala. Rasulullah sallallahu alaihi wasallam in many of his du'as, he would actively ask Allah subhanahu wa ta'ala, seek protection from mental illnesses and mental issues, such as Allahumma inni a'udhu bika min al-hammi wal hazan. Oh Allah, I seek refuge in you. Ya Allah, protect me from having to go through mental discomfort, calamities, or any sort of depression. Rasulullah sallallahu would also make du'as. So Islam acknowledges that the mental well-being not only for our physical well-being, but also for our spiritual well-being as well. So there's an active push from Islam to be active and to take care of your mental well-being, your inner self. Then one of the du'as Rasulullah sallallahu used to make is Allahumma ja'al sarirati khayran min alaniyati. Allahumma ja'al sarirati khayran min alaniyati. Ya Allah, make my inner self better than my outer self. So there's an active push and encouragement that Islam is giving to take care of your inner self, your nafs, your mind, your heart, and all these things in order to enjoy a healthy and wholesome life in this world, and also live a spiritual life as well. So from all these things, we understand that Islam acknowledges such issues as problems, and seeking out for solution for these problems is part of our deen. Rasulullah sallallahu alaihi wasallam says in a hadith that Ya ibadallah tadawaw, O slaves of Allah, seek out treatments, seek treatments. فَإِنَّ اللَّهَ لَمْ يَضَعْ دَاءً إِلَّا وَضَعَ لَهُ شِفَاءً أَوْ دَوَاءً. That Allah subhanahu wa ta'ala did not put any disease, any illness, any ailment, except that Allah subhanahu wa ta'ala has put along with it its treatment or its cure. So from all these things, we can understand that when a person faces any discomfort, any trouble, any calamity, or any sort of illness, diseases, that we're encouraged and we're supposed to seek for shifa. But at the same time, we cannot forget to reach out to Ash-Shafi, Allah subhanahu wa ta'ala, the one who is responsible for testing a person, and the one who is actually cleansing a person through those trials and tribulation, and the one who has power to grant cure and shifa. So may Allah subhanahu wa ta'ala give all of us the tawfiq to be a true believer, a strong believer. And whenever we see any problem, that we seek out the necessary means to to tackle, to counter this problem, and to find a solution. Alhamdulillah, without any further ado, I will inshallah give my mic to our guest here today, Dr. Omar Sobhani. He's a psychiatrist in the Detroit area. He completed his training at Michigan State University and Wayne State University, and recently took a faculty at Wayne State University and Detroit Medical Center. We're also blessed to have with us today Dr. Ali Reza Amir Sabri. He's also a psychiatrist, and he serves as the Associate Chair of Clinical Services and Chief Medical Office for the Department of Psychiatry and Behavioral Neurosciences at Wayne State University. We're also, alhamdulillah, blessed to have with us another is also she's a double board certified graduate degree from the University of North Carolina at Chapel Hill, and her medical degree from Wayne State University School of Medicine. Alhamdulillah, we're again grateful to Allah subhanahu wa ta'ala, and we're thankful to our guests for giving their time and making time for us here. So may Allah subhanahu wa ta'ala bless our guests, and may Allah subhanahu wa ta'ala bless all of you brothers and sisters for coming here and showing your love and concern. Jazakumullahu khair.
Good. Assalamu alaikum. Can everyone hear me okay? Okay. Jazakallah khair, Imam Tazim and Ustad Ishtiyaq for setting this up and inviting myself and Dr. Amr Sadri. We're very honored to be here. And I wanted to thank everyone here for attending and this event. And I was telling Dr. Sadri, the parking lot's so full, we had to park on the basketball court. So alhamdulillah for to show it speaks to the concern of the community on a very serious topic. And before I start, I'd like to pass my condolences to first the family and this community for the recent tragedies that you have sustained. As you know, we say, "Adham Allah ajrakum," meaning may Allah increase your reward and give you patience and understanding through this tragedy. So I've been asking Imam Tazim and Brother Ishtiyaq about this community, and since I'm not very familiar with everyone here, and what maybe how we should take this discussion today, and I did put together some slides here, giving an overview of mental illness and mental health and the signs and the symptoms and the treatments and all these things. And I was thinking about it all through the day and discussing with Dr. Amr Sadri, and we were thinking that instead of me going through these slides, I would much rather send them to Imam Tazim and have him forward them to you as a community, so you can use them as a reference. Okay, and instead, what I'd like is to have an open discussion today in the time that we have, so we can better understand the needs of this community, what questions you have, and how you want to make this event beneficial for you. We know that mental health and mental illnesses are very difficult to talk about. And oftentimes those who suffer, they suffer in silence. You can see there's outward signs of internal struggle, although there can be if you look hard enough. So what I'd like is, if there's anyone who has a question or anyone who has a certain direction that they want to take this talk, I would encourage anyone and hope that people will speak up so we can better understand your needs. That's a fantastic question. That's an excellent question. Now, Imam Tazim, in some of the hadith that he was sharing, he mentioned that these mental struggles have been there since the time of the Prophet and well before. And all of us have nafs and desire and hopes and fears and disappointments. And we all experience sadness and joy and worry. In fact, some of these feelings are Allah subhanahu wa ta'ala gave them to us to help us as a signal that there may be something for example, anxiety and worry, it can help us when we're taking a test, when we're preparing for something. So these are all normal and beneficial. When they become a problem in the world of psychiatry, we think of two things: distress and dysfunction. Okay, distress meaning that it's an unpleasant feeling. Okay, you feel that there's something wrong. And this can be an internal or it can be someone noticing it about you. The other thing is dysfunction, meaning it causes whether that be in school, whether that be how you relate to other people in relationship and families, your eating and your sleeping, All these things we use as signals to help and opportunity for understanding. Okay. Do you have any a follow-up question? Okay.
Understand that something's going wrong and take that first or take necessary steps with that.
Mhm.
That's, I think, that is the patient purpose.
Absolutely. Oh, yeah. I apologize. To repeat, the first question is how we tell if there's something wrong? What should we look for as far as signs and symptoms? That was the first question that the brother asked. The second question was how to, if you can repeat it, just to the next level. Yeah. Okay. Yeah, absolutely. So how to, after we pick up on the signals and we sense that there's wrong in our children, in our loved ones, in our friends and family, how do we take the next steps? Where should we go? And how to address the issue. Now, what I will say is that what we have found in our work together is that all symptoms and all mental illnesses are a form of communication. Okay, so the first thing would be is to have a establish and cultivate a relationship with each other, and this in the but also in the masjid here, where creating a space where there is communication and there is openness and there's trust, because people will give you signs. It's our job to be mindful of that. Okay, even those who isolate themselves, sometimes they isolate so people will come through that door. So simply being accessible and reaching out has tremendous power. Okay. Now the other is after identifying a problem, know that there will be some resistance on the part of the person. And you have many options. It can be oppositional or it can be an opportunity to work together. Okay. Now, in our culture, and this is a problem in a pattern in the Eastern culture. There is a lot of fear from going to a doctor, and this is understandable. But that's why it brings an important point of putting ourselves in that profession, because there is, intentional or not, there is cultural bias from any doctor, and there's fears of going to the doctor and talking about these issues. And the more Muslims and people from similar cultures are in the focus, will lessen that worry. Next, I'll say is that most people, many people fear going to talk to the psychiatrist or the therapist because they have a worry that whatever they carry is so painful or so bad that it cannot be helped. Okay. And this is a very common worry, but it's a worry that can be worked out and discussed. And this can start from a mother and her child, or a father, or the imam, or the community members. Okay. Yeah.
I would like to expand on what Dr. Spani said, and these two questions, in fact, are excellent questions. The slides that he mentioned have those symptoms that you need to look for. So it says, for example, if someone has depression, It may show itself in problems with appetite, problems with socialization, problems with communication and temper, etc. So those are in those slides you can review. What is available is that a lot is available, but you need to know the system. And that's why you need to ask for professionals who do this every single day and ask for help. Asking for help it requires courage and it requires strength. So don't think that you're weak and it is a sign of weakness if I ask for help. It is a sign of strength and courage. So have the courage to ask for help. The third part that I would like to share with you is that many years ago, we were thinking about quote unquote mental illness. Nowadays, science has improved so much that we know that mental illness is not different than other illnesses that we go through. It is cardiovascular, heart disease, respiratory disease, lung disease, kidney disease, liver disease. It is brain disease. It is not like you have a stroke in your head and then you get paralyzed, but mentally, if you got ill, that type of stroke shows itself in your function. He mentioned distress and dysfunction, meaning that the functions that you had with the community, within the community, in your family, are going to be dysfunctional. He mentioned that our communications and the emotions that we have are the way that we want to connect with each other. So that means that the person who had the mental illness, the mental stroke, that person won't be able to function the way that he or she was functioning, and that communication will be impaired. The result of that lack of communication will be distress, not only in that person, within the whole family. So mental illness is not the illness of one individual, it's the illness which spreads around in the community, in the family, within that system. So it's very painful if we don't ask for help. But also, as Dr. Subhani mentioned, this is a sign, this is a signal. It means that there is something going on in me, not something going on there in me. And that something needs to be discovered, what it is. That's why you need to ask for professional opinions. Don't go after very old ideas when we didn't know much about these types of illnesses. It is the mental illness that will create the heart problem for you, the gastrointestinal stomach problems for you, the lack of energy for you, the poor concentration and not being able to function at work, at home, with your loved ones. So this is not a sign that we need to think that this, oh, I'm weak if I ask for help. And the last part that I want to make is that, again, as Dr. Subhani mentioned, the individual would resist your help. Do you know why? Because of the illness. It is not that there is something bad or that she is ill. So it is our obligation. It is our duty as brothers, as sisters, as husbands, wives, fathers, mothers, to go extra, to take extra steps and help the individual and take him to people who can help them. So these are all things which are quite biological. Nowadays, we know, for example, the sources and what happens in our brain. For example, all of us know if I get a cold or flu, I don't feel good. I feel tired. I want to sleep. I don't have appetite. Well, you know what the difference with depression is? Nothing. When you get depressed, you don't feel good. You don't want to sleep, or you want to sleep all the time. You don't have interest in other things. It's the same thing. And what has found is both of them cause inflammation in your brain. So again, I'm emphasizing on the issue that depression or any type of mental illness is not a sign of weakness. And we need to put all the courage we have inside us to be able to understand, accept that this is something that I need to ask for help.
Mhm. So the question is about timing, and the brother said, again, he pointed out the difference in cultures and approach to these symptoms, and when is the right time to seek help. Now, what I'll say is that the symptom that comes up, whether it be the depression or anxiety or lack of sleep or difficulty concentrating, this is one of many. Okay, we in psychiatry, we have lists of the symptoms for each illness. Okay, and the way we is a totality of symptoms. So 5, 6 things that we pile up together. The fact that it causes a disruption in the patient's life, and the fact that those around him and himself know that there's something wrong. All of those things together will make it clear for you. Okay. Now, another piece of this is about the person. The person will let you know. This may not be intentional, but let you know that they need help in their most stressful time. Okay. So they'll give you opportunities, whether that be through words or their behavior, asking for assistance.
That's also a great question. There is no bad time. If you think you need to ask for help, please ask for help. And the good news is that at this point in time, in comparison to many, many years ago, when I started my practice, there is much more help than it was back then. Nowadays, we have somewhat more culturally competent individuals who can provide help to this community. We need to find they are, and we need to ask for help from them. You go there, you are not going to lose anything. The individual will sit with you, will ask you questions. He or she will ask, how can I help you? You tell them, it will come from you. You tell them. Without realizing, you will tell them how they can help you. And that's the good part of it. The bad part is that we don't have enough of them, number one. Number two, because of different cultures that we have in different countries, the presentations, the manifestations, the desires are somewhat different. But if we don't focus on the differences and look at the commonality, then they can help. Maybe they don't speak your cultural language, but they do understand you. If they don't, help them understand you. Teach them to understand you. Don't stay back. Be assertive and ask for answer. But when you ask for answer, you're ready to be questioned so they can ask you. In other words, Imam was talking about, if I remember correctly, about Islam in general, which means from the two parts, if you look at it. One is surrender. Don't fight it. Surrender, and then have the courage to ask for help, so you will be helped. Islam, the word has health in it. The word has worth in it. So when you surrender to whatever you have to surrender, then you can be a giver. You can give to your family who is sick, or you can give to yourself to receive health. You know why? Because when you reduce tension, your stress hormones, your neurotransmitters in your brain, they will go down, and then you will flourish. So asking for help is, I'm repeating, I will repeat this 100 times if necessary. Asking for help is courage and strength. And if your family member, whomever, the loved one, who's not asking for help, you sit there, try to listen to them. Don't tell them what to do. Don't tell people what to do. Ask them how I can help you.
Go ahead. So I'm very glad you asked this question, because this is a very important question about medication, and the common concern that when you go to a psychiatrist, the first thing they do is they start you on a medication that will and that they keep increasing it, and that you'll be hooked on the medication. This is a common concern, and what I'll say, and I'll also let Dr. Amr Sadri give his insight here. But what I'll say is that you have to be participating in your care. Okay. Now, for treatment, there's many treatments that we know. There's treatments of medical illnesses that can affect your mental health, things like sleep apnea. Okay, so there's this piece that you have to keep in mind of. There's things like lifestyle, diet, exercise, these things. There is psychotherapy, being able to discuss the conflicts that you carry. Now for you to kind of educate you is that or to give you some insight on how it works. This takes commitment. This takes going to the psychotherapist. These days there's also Zoom and being able to discuss parts of yourself. Now, in some mental illnesses, the symptoms are so severe and the chemicals in our brain are so out of balance that psychotherapy will not reach its benefit. Okay. And that's why we use medication as a tool. It is a tool only. Okay. And it will regulate the transmitters in your brain. It will bring them back up to normal levels So you are able to participate in not only your life, in psychotherapy, in your work, in your relationships, all these things. Now, if there's a concern about medication, there's no medicine in the world that the doctor gives to harm you. It's to help you. But a piece of this is to ask the doctor questions. Why, what is this for? The dosage, why increase, all these things. Now, some of these medications, I'll tell you, for them to work effectively, they have to be built up a certain level in your blood. So, for example, a medication, an antidepressant that's at its lowest dose is effectively not giving you anything. Okay, that's why they have to build it very slowly, the levels in your blood, so that you can start to see the effects. Now, as far as side effects, one of our teachers tells us that if there's no side effect, that means the medication is not working. But there's more to the story. Okay, there's always a balance, and there's always communication with the doctor to tell him or to tell her, this is how I'm feeling, and this is what I don't like. Okay.
So the issue is that, first of all, you have no obligation to take the medicine which causing side effect for you. You just be honest with yourself and honest with your doctor and tell him I have this issue. Two, any physician in any specialty does not want to hurt the individual. They want to help. However, as Dr. Subhani said, if you have side effect, talk to them and let them know that this is the problem. Now, if you look at just for the symptoms of depression, one of the symptoms may be that the individual cannot sleep. Further, in general, in Eastern culture, depression does not manifest itself like the person comes to you and say, I'm depressed. They come to you and say, I cannot sleep, I cannot eat, I don't have energy, I cannot focus. In Western culture, people many times come and say, I am sad, I don't feel good, I don't want to communicate. But then we'll go to symptom definition. So the physician who's talking to you, the psychiatrist who's talking to you, will try to reduce the symptoms that you have. Let's assume that the person cannot sleep well. So they will give a medication to help them sleep better. If it is too strong, you tell them it's too strong, so they can reduce the dose. It is too weak, you tell them, I'm not still sleeping. They will up the dose. So that's one part. But the second part is that we need to understand the one who's in charge and is in control is us, not the doctor, is you. In other words, you are the one who need to communicate to the physician what is going on inside you. They can't read your mind, most of them. And the other part is that if you of what has been going on. So I go back to what was said. You are in charge, you are in command, you tell them what's wrong, and I'm sure that they will try to do their best to help. Having said all that, there are some significant illnesses like schizophrenia. People who start hearing voices and see things, etc. Sometimes you need, in the beginning, you need to sedate them to relax the brain, for the brain to calm down. After they get better, they will reduce the dose of the medication.
Yeah, we have Dr. Saba Maruf on the other side also. So yeah, any of the sisters, if you have any question for her, or if you want to say something, you're welcome. Also in the back, there are some like an arrangement as well. If you want to make a sister, so I'll come in the back also. But right now, if you have any specific question, or sister Sabamar, if you want to say something, yeah, please. Yeah.
Assalamu alaikum, everybody. The parking lot was, and that really is a testament to all of you and your commitment and dedication to kind of, coming together as a community for comfort and coming for answers. And that's really the first step. I also want to say one thing too, that in terms of this, mental health and the history of mental health, we actually have a very rich history in Muslim civilization in addressing and identifying mental illness. If any of you guys follow Dr. Rania Awad, she has a Stanford Muslim Mental Health Lab, and she started an organization called Aristan, and that's what it's rediscovering our roots in identifying and addressing and treating mental health. This is actually not new ideas. It's not even necessarily Western ideas. We actually have this in our tradition. And, the Imam shared some beautiful ayahs and hadith that asking for help is part of our faith. We have an obligation. Our bodies and our mind are an amana for us, right? This is a trust Allah has given to us. We have to take care of it. And if we don't take care of ourselves, we can help take care of our children, right? What do they always say when they're giving the flight attendants giving you the instructions on safety? You put your own mask first before you help your other people, the oxygen mask. So we have to. I mean, there's, our kids are going through a lot of struggles before the pandemic, and honestly, during the pandemic and after the pandemic, we're still kind of dealing with the aftermath of that. And I think many communities in the area are doing a really good job in addressing these sessions and during sessions and this topic. But we definitely have to make it a regular thing. It can't just be in reaction to something. We have to make this like a regular conversation, and especially for our youth. Another thing I will say, being a child and adolescent psychiatrist, I was just at my kids' school this week talking about, there was like a career day. And one of the kids actually asked, what do you do if you do want help and you want to see somebody, but your parents aren't really they're not really for it. They're kind of off, or they don't want you to. And this is a big problem. I'm actually seeing this a lot. I used to volunteer at the clinic, which is a clinic for patients without insurance. And we actually have seen kids there, or not kids, but adults, young adults that are under their parents' insurance, but their parents don't want to give them the mental health treatment. And so they're coming to Huda Clinic to get that treatment. So this is something that we really kind of have to look inside ourselves. And a big part of that is education. So that's something that we can talk about, having regular educational sessions, small group, big group, so that, we can ask these really important questions. And so that, we can kind of address things and protect ourselves throughout, and not just, always, hopefully not in reaction to, tragedies.
I want to add to what Doctor said in here about Islam and the history. Islam used to be the bastion of science and knowledge. Over years, some things happen, but it is inherent in this religion that if you really practice it the way that it should be practiced, and the way that it has all meanings in it, you will create scientists, you will create educators, you will create doctors, lawyers through Islam. And I'm not talking about Sharia and all that. I'm talking about deep down, if someone goes through it. There were hospitals before any hospital was in the Western world. There were discoveries before any discovery was in the Western world. We have lost track. So we need to rediscover as Muslims, Islam. That point that, and we have to be proud. And as was said, ask for help. See, I'm repeating myself. Ask for help. If you ask for help, you're not going to lose anything. If you don't ask for help, be sure that maybe you are going to lose something.
We have one here.
I know that you are communicating with the person or person, family, but I tell you something, that some of the stigma that we have, that the whole community, you probably have some recommendations for the community, how they will try to support the person who needs help. What do you recommend?
Question, the question also a very important question about what can the community do to help people working with these illnesses. Dr. Maruf, do you have any?
I think that's a really good question. I think number one, to be honest, is what we already have is our community. This is a huge advantage that we have. A lot of the people that we see are kind of isolated or very lonely and actually don't have connections with the community. So just having a community in and of itself is already a huge, I mean, you're kind of ahead of the game. And I think that the pandemic taught us, though, is that how important that is. You know, we are human beings. We're created to be social, whether you're an introvert or an extrovert. You know, being social distancing and isolating ourselves was very difficult, harder for some people more than others. So, and I think actually after the pandemic, there might be people that we haven't seen in a long time. Some people were still kind of socializing in their bubble, and some weren't. So one thing is, you know, there tend to be kind of our friends and kind of our group that we tend to socialize with. But I guess checking in with people, if there's somebody that you haven't seen in some time, then check in with them. If you know somebody is going through a hard time, check in with them and check in repeatedly, maybe not just one time. And, you know, don't feel like someone might be pushing you away. I think just, you might feel like you don't have the right words to say. I mean, I'm a psychiatrist and I feel like that sometimes. I don't know the right exact thing to say during difficult situations. But just there and can be a big thing. You don't have to be a therapist. You don't have to have the exact right words to say. You don't have to have the perfect solution, but just being there for somebody can, you know, be a really big help. And then also just slowly, again, encouraging them to get help. And, you know, maybe working with the people that are close to them, like also encouraging them to keep talking. I think keeping the lines of communication and keeping that connection is a big thing.
Now, I'll just add another piece here of the community can take a lot of steps to help the community itself and to help those who struggle maybe outside of the community by building relationships with mental health services. This will take a lot of patience and a lot of trial and error, but it can be done. You know, Wayne State has made connections with communities and can provide services that it works for both sides. So it's one piece. And the second piece is something I mentioned earlier, and I discussed with Dr. Amr Sadri, is that encouraging our youth to go into these fields. Okay. That way we get people who think and are familiar with the things that we grew up with to help us and to better understand us. Okay. Yeah.
I want to piggyback on what was said in here. The treatment for depression and anxiety under a name, because there are many different names for them. They have 4 principles in it, 4 or 5 principles. 1, healthy sleep, enough sleep. 2, healthy eating. Healthy eating meaning that the food which we all know is not going to be good for us not to have. 3 is positive socialization. Positive socialization with people who are positive. Don't hang around people who are negative. They say something, go. Don't stay. The last one is discovering your own rhythms, which will start from your breathing, because you can control your breath. There are not many other things that you can control directly. It starts with breath. And if you look at all wellness programs which are around, all meditative movements, meditative arrangements which are around, it starts with breath. If you learn how to breathe, you will reduce your stress level. And when you reduce your stress level, you will start growing internally. And that's called wellness programs which are around. And this is not the time to show these things. Maybe at some other point, we can discuss how to use your breath, how to use your breathing to calm yourself and other people down around you. In fact, again, I go back to, because we are in mosque, in Islam, this is inherent in Islam and the teachings of Islam, real teachings of Islam, that breath is something which will, as it refreshes your body, it also refreshes your mind, your brain, your thoughts.
I just want to add to exactly piggybacking on that too, just so many of the acts of worship that are, again, inherent to Islam. If you think about it as a way that this is actually good for your mental health too, it's all right there. Doing dhikr, really focusing in your salah, and, having, what dua is a personal conversation with Allah subhanahu wa ta'ala. All of these things are, actually good for your mental health. The other thing I want to add too is, actually, mashallah, we have so many young people that are going into the field. We actually have a Metro Detroit of local Muslim mental health practitioners that we kind of keep in touch. If somebody asks me that they need a referral, they give me some information, then I literally put it in that group. I'm not with, keeping it private, the no identifiers or anything. And we try to connect people with a good match, like someone that might, that takes in their insurance, is in they're okay with being in person, or telehealth. They're looking for someone that works with this age group. So we actually have that. It's not like a formal, but kind of an informal way that we connect people with Muslim mental health practitioners in the area.
So I would like to ask the youth to ask the question. Usually, just lately, last week, the Surgeon General said that the social media and the other tools that give to this generation is not helping this specific cause. If you want to address that issue, maybe we'll touch upon.
Effects of the question was regarding the effects of social media on mental health of our young people.
Well, the social media is the bottom of the barrel of ignorance. Unfortunately, science psychologists, social psychologists have been sitting around with computer people, creating programs which will manipulate our brain. So it will be very difficult for anybody, and I will come to kids, for anybody to leave it alone, because it will work on the reward system of your brain. It will stimulate repeated your brain such that you cannot give it up. So it requires quite a bit of strength to say, I'm done, I don't want it. The effect on the kid the kid's brain is growing up to age 25, 26, even for some people, 27, 28, the brain is still growing. And as it grows, how does it grow? It grows with the stimulations that it receives from outside. If the stimulation is negative, what I'm going to grow inside me? Negative. If the stimulation is positive, and that's why I repeat myself, positive socialization, education, training, those are the positives. So you will create a better future for your child. If you expose them to whatever you're exposing them to through social media, then that's what we're going to get. And remember, who is benefiting from it? Those who are making money out of it. So they don't care about your child, my child. They care about their pocket. It's wrong, but that's what they do. But I'm sure the doctor who is a child psychologist can expand on this whole lot more.
We would like to continue this after that. Would you mind saying a different? We really love it because it's so many people are just.
What should we do?
We want to take a break. Okay. So we can,
There is a breakaway session if sisters would like to talk to them. A lot of young people, they have questions and they are just not available.
Yes, we could be very. Yeah.
So inside one can set up for you. Want to be young people, so you want to talk
Jazakumullah khair. Thank you once again to everyone, especially our guests, for coming here. We really appreciate your presence here today. Alhamdulillah. I believe this was a very productive session, and inshallah, we'll try to have another follow-up session, inshallah, and we'll try to bring more and more individuals like them, like professionals, inshallah. After the salah, we have a and to have a breakout. The sisters, inshallah, they can have their session with the sister Dr. Maruf in the sister area. Thank you so much. So inshallah, once again, after the salah, if all the youth brothers can go to the multi-purpose room, and the sisters, they can have a session over the sisters area with Dr. Maruf. Thank you so much.